Welcome back to the podcast, Heal Without Harm. My name is Dr. Clayton Dir. I'm a physical therapist and I'm the one bringing you the truth on the medical system. Today's podcast is going to be over the IT band or IT band pain syndrome. Something that a lot of people suffer from, specifically runners, is usually what I see. And I feel like it is getting mistreated over and over and over again. And I think that's the reason that you still have it, or at least it keeps coming back and you just can't keep it away forever. Things that I usually hear people doing about it that are getting them little to no results is foam rolling the IT band, trying to stretch the IT band, and ultimately trying to treat the IT band. This was actually brought to my attention and reframed a little bit differently to me by a student of all people, by a student physical therapist. He said that the IT band is like the Achilles tendon of the hip. And so what that means is, if you think about your lower leg, you have your calf muscle, and then you have a big tendon called the Achilles tendon that goes down and attaches from the calf muscle to the heel bone. If someone has heel pain, me and most of my colleagues as physical therapists are going to go treat the calf muscle and strengthen the calf muscle, and we will watch that actually decrease the pain and problems in the Achilles tendon. Why do we not treat the IT band the same way? So while you are trying to stretch this IT band, while you are trying to mobilize and or perform soft tissue work to the IT band, you are far too much treating the symptom and not truly the root cause, at least in my experience and everybody that I've worked with that we've gotten great results with. I want you to know that the IT band is actually a tendon nonetheless. And instead of being like a cord, it's more of a thin, wide sheet of tissue. And rubbing up and down it really isn't going to deform it at all. And what I mean by deform is break it down, loosen it up, change it. It's not going to affect it that much. That is more of just the symptom downstream of the true problem. And so other things that I've heard is rest. So let me just not do the activity that bothers it for a little while. Maybe foam roll it, like I said, stretching it, like I said, even anti-inflammatories like Aleve, ibuprofen, Tylenol for pain relief at least, and even sometimes, even sometimes injections. But none of those are going to be a long-term fix because the majority of the time when it comes to an IT band pain or any sort of itis, like a tendonitis or a tendinopathy, there's a load issue, a capacity issue, meaning that tissue is not tolerating how much activity you are putting it through. Sometimes it's because it's globally weak, there's a weakness issue, and sometimes it's because you did too much, too fast, after doing too little for too long. And so you essentially started running 20 miles a week out of nowhere. Or you decided to jump for the first time or sprint for the first time, something like that kind of set it off. The way that I want you to think about how to appropriately treat this is, one, I will still recommend go to a physical therapist, get properly evaluated, and then get properly treated. Go through their program because it's going to get you the best results. However, if you're listening to this podcast, you either want to try to DIY this or you are still just in the information gathering stage, and that is totally fine. But I will say, if you want the best and fastest results, seeing a physical therapist will be the best option for you. Moving on to why do you have IT band pain in the first place and how to appropriately treat it and why what you've been doing is not working. I want you to think of IT band pain as the Achilles tendon, like I said, of the upper portion of the leg. What muscles make up the IT band, do you ask? That's a great question. If you think of the side of the hip, I'm just going to call them your glutes, okay? There's multiple muscles in here that I will go ahead and tell you all the names of, but we're just going to globally say the glutes or the lateral hip. There's a muscle called the TFL, tensor fasciae latae, and you also have the glute medius, glute minimus, glute maximus. All of those come in and tie in and make the beginning of the IT band, and it's going to be on that lateral bump on your hip. That is called the greater trochanter. Those muscles come together and form the beginning of the IT band, and then that IT band goes from the lateral hip all the way down to actually the lateral shin bone, which is really interesting. It crosses the knee joint. Its job is to provide lateral stability to the leg. So if it's doing its job well, your knees run and land straight. They don't cave in internally. They don't dive in towards each other. The reason this is so painful for you is, one, that IT band at the lateral knee or the outside of your knee does rub over some bone. And that is normal. That's okay. That's not a problem. But when it's irritated, when it's angry, when it's tendinitis-y, it's going to be very painful. It's going to be very painful when you bend your knee from about 5 to 15 degrees of knee bend. So not quite fully straight, but just those last 10, 15 degrees are usually quite painful for you, which is the exact amount of knee bend you get when walking, jogging, and running, which is why those activities are so painful for you. There's also a bursa underneath it there. Bursa are little sacs that are supposed to reduce friction. When those sacs or those little bursa sacs are irritated, they are like little toddlers where there's a little bit of tissue damage or a little bit of irritation, but oh my golly, do you have a high amount of pain? Those things throw huge temper tantrums and cause you a lot of pain, even if the damage is not that great. It is a very disproportionate reaction to the level of irritation. That's the reason you can have such severe pain in the lateral knee. So you have muscles that turn into tendons and then they span down the side of the leg. The reason that you are not getting symptom relief necessarily when you're rolling the IT band is you're mostly just rubbing on this dense fascial tissue that's not going to change much, and you're also squishing on the lateral quad muscle. Now, if you have issues in the lateral quad, you may get some benefit from foam rolling. It'll probably be short-lived, but you may get some benefit. If you want long-term solution, you need to go higher up. You need to treat the lateral hip. You need to strengthen the lateral hip. And if you're going to a physical therapist, specifically one like me, you are going to get dry needled most likely, as long as you consent to dry needling to the lateral hip. If you go and take that foam roller, you set it to the side, you swap it for a lacrosse ball or a baseball or some sort of soft tissue work like ball, you are going to roll around in the TFL muscle, the glute minimus muscle, the glute medius muscle, and the glute maximus muscle. And you are going to notice that those areas are super, super, super tender to the touch. It's almost like there's trigger points or muscle spasms or knots within those muscles. Those muscles are doing the best they can, but they're struggling to handle whatever you're putting them through. And so they are going into spasm. You are going to decrease your pain, most likely, by rubbing on those muscles. You're going to find the sore spots. I call it search and destroy. You're going to pin those muscles down wherever they hurt, and you're going to hold that for a matter of 30 to 60 seconds until you feel that tender spot actually release a little bit. You'll feel the pain drop from a 6 or 7 out of 10 intensity to a 3 or 4 out of 10 intensity. And that way you can help kind of treat that muscle temporarily, then roll on to another spot and repeat the same process. You will notice that your pain in the lateral knee will most likely go down, at least short term. After releasing these muscles or getting them to decrease in pain, you now need to teach them how to work again, teach them how to function appropriately, make them feel comfortable doing their job. That is when you're going to layer in some hip rotation and lateral hip strengthening. My 2 favorite exercises, if you've been following me for any amount of time, you know that I'm about to suggest the 90-degree clams and the 7-way hips. Yes, the old Jane Fonda muscles that she has been trying to help you strengthen all along. Those are going to start teaching these muscles how to stabilize your hip in a lateral perspective so that you can run and move like you want without IT band pain again. You strengthen those muscles up, and then you repeat this process daily until the pain goes down or the pain goes away. And that ultimately is how you treat IT band pain, at least in simple terms. Sometimes I will also give people exercises like the 90-90 hip rotations, sometimes called windshield wipers, sometimes called shin box rotations. And then if we notice that TFL muscle, which is an internal rotator of the hip, but sometimes a flexor of the hip, meaning it helps lift the leg. If we notice that is in pain, I will often give them a 90-90 plus movement. Now, of course, right now you were just watching this video, so you're like, what are all these exercises? I will put my email down below along with the videos that I'm referencing, the 90-degree clams, the 7-way hips, and the 90-90 pluses. I will put those down below so that you can just go click on those or at least send me an email and I will fire off a response right over to you within a couple days of those exercises so you can get to work on solving your IT band pain. Here are some other things that I've heard that people have done to try to relieve their IT band pain that I don't necessarily recommend unless it is absolutely the last resort and you've tried everything else. Is I've heard of people getting an IT band pain release, which is wild to me. But what they do is they actually do a zigzag pattern of like cutting that IT band to try to elongate it and make it not so tight. However, I will still argue it is a contractile tissue, and it is something that is supposed, how do I want to say this? It is probably tight for a reason, and oftentimes tightness is secondary to weakness or your body feeling uncomfortable letting that muscle or tendon elongate. So it was improperly trained is what I would argue. So if you are thinking about getting some sort of IT band surgery, I would recommend against it overall, unless I've evaluated you and agreed. But of course, I am not your PT unless you want me to be. So to wrap this all up in a pretty bow, the goal is to improve your capacity to handle the loads that you want to do in life. Most of the time, you just need gradual progression of strengthening or gradual progression of running more miles each week, and you can ward off any of these issues. If you have any questions, please send me an email. It'll be down in the description. If you know somebody who is suffering from IT band pain or lateral knee pain or lateral hip pain, please send them this podcast, whether it be on YouTube, Apple Music, or Apple Podcasts, Spotify, whatever platform you're listening on. Also, if you are not already following me or subscribed to these channels that you listen to me on, please do that. It really helps get the numbers up, get me out to more people, help me bring on cooler, bigger, and more awesome guests to the podcast, and also just helps me help you relieve whatever pain that you are having by seeing a physical therapist primarily. I hope today you learned a little bit more how to heal without harm. Thank you for your support. This is a lot of fun, and I've really enjoyed seeing all the comments and replies and emails from all of you guys getting better by taking what I am teaching you into your life and applying it. We will see you guys later.